I have already checked my patient's medical record and checked for their mobility, any allergies that they might have, any medications, drains, Foley's, IVs, and confirmed that I have an order from the physician to place an indwelling catheter. I already washed my hands prior to entering the patient's room, and I would put on PPE as indicated. Today it's universal precautions, so I just need my mask for COVID. And now I'm going to enter my patient's room, introduce myself, explain the procedure, and get everything together. So, good morning, Mr. Williams. My name is Jazzie. I'm a P&W nursing student. I'm going to be placing an indwelling Foley catheter. It's just a small tube that goes in through your urethra and into your bladder, and it's going to help drain some of that urine that's there and relieve some of the abdominal pressure that you're feeling, okay? Can I just check your ID band? Can you state your full name, age, and date of birth for me? Perfect. And I've already taken a look at your allergy record, but do you have any allergies to iodine or latex? Iodine? Okay, I will make sure we do not use that today, okay? Are you in any pain whatsoever? And are you comfortable in this position? Perfect. So I've already closed the curtain and the patient's door, and I've raised the bed to a proper working height for me. And my patient is comfortable in his bed. I'm now going to raise my patient's covers while still keeping him covered. And there's already a chest pad, a waterproof pad underneath the patient. And I'm going to just assist him in moving his legs out for me. Okay, now I'm going to do hand hygiene and put on clean gloves before I perform peritoneal care.
Into a workable location.
Okay, I'm making sure that I have adequate lighting. And I have my waste receptacle next to me here. So now I'm just going to clean my patient. Okay, just going to take and turn it downward, switching my each time.
Iodine. You have an allergy to iodine, okay? And then you draw the curtain and close the doors. You provide privacy and make sure the lighting is adequate.
And around and down again.
Adjust the bed to the workable height.
And then just clean the groin area here. Okay. We will dry him off with a clean towel. And I will drape that over him for added privacy. Next, I will remove my gloves and perform hygiene again. And then set up my Foley catheterization tray. I made sure that it's not expired, it's latex free, and I will not be using the iodine that's in it today. So I'm just going to take my bag here.
Now we have the patient brought right out. So we'll be able to do the procedure and expose just enough. And now I'm going to put a big towel on the patient. My water basin.
And grab my sterile gloves.
Now I'm going to
to set up my sterile feel.
I am going to change my gloves.
And make sure that I keep my gloves sterile. Place that underneath my
And
patient.
I'm going to prepare my kit. And my bag is my little mini procedure.
Okay. And then I'm going to drape this over my patients. Okay. Okay, I'm going to discard the iodine due to his allergy. I'm going to moisten my cotton balls with the hydrogen peroxide. I'm going to
Now I'm going to set this down.
hook up my syringe. I would open up my lubricating jelly. I would place my catheter, the tip of my catheter in that. Next, I'm going to clean the penile region, holding it with my non-dominant hand.
I did not need that. This is for the mail. So now I'm going to line items into my sterile field. And since my patient has an allergy,
If you had foreskin, I would make sure I pulled it back and cleaned underneath it as well. Now I'm going to discard that into the sharps container. I'm going to grab my catheter. Okay, Mr. Williams, I'm going to just insert the catheter, okay? Should feel just a little bit of pressure. Okay, and I'm going to insert the catheter slowly. If I meet resistance, I will turn it. And normally I'd be able to put it up to the Y of the catheter. However, I don't think that will happen today. Actually, oh, look, perfect. So now I'm just going to hold it and insert the water, the balloon with my saline. And then we'll pull until if I had a leg band, I would connect it to this portion of the catheter, to his leg, and then I would take his urine bag and place it on the bed below his bladder to prevent backflow. At this time, I would take a clean batch of urine for any specimen collection that I would need, or later on if I needed to, I would kink the catheter with this and remove it from this port after cleaning it with alcohol. And then I would clean up my supplies, perform peritoneal care, place the patient back in comfortable position, put the bed all the way down, and just check on my patient's bag to make sure it doesn't get too full. It's been a couple days later. Now I'm going to remove the catheter. So I already obtained the order, checked his medical record, I've checked and identified my patient, made sure he's comfortable and within no pain. I've raised the bed to comfortable working height, closed the curtains, I have adequate lighting, and set up everything. Now I'm just going to remove the Foley. Actually, I'm going to do this first. And I would remove any urine that's in the bag and measure it. Then I would attach my syringe and deflate the Foley balloon. Okay. Alright, so just take a deep breath and breathe out for me. I'm going to remove your Foley in the coiling method, and then I would put that into my glove and discard of my gloves. I perform peritoneal care. And again, put my patient in a comfortable position, clean up my area, put the bed down, and just check on my patient.